Oh, am I audible?
Yeah, you were
Can you
audible.
hear me? Yeah, you are
Yeah.
audible too. Good evening. Good evening, everyone. And we are here today to discuss on the topic expression and storage of breast milk. And today we have here Krishna Chaudhary. She's a PhD scholar, MSc Pediatric Nursing, and she's also a certified lactation and IYCF counselor. Welcome, Krishna, to the discussion today. So over to you.
Thank you, Priyadarshini, and thank you so much for having me here. Um, so, like we already know that we are celebrating World Breastfeeding Week from every year from the 1st of August to 7th of August to create awareness among the mothers, so that to improve the overall health of the newborn and to make breastfeeding a very comfortable journey within the period.
Yeah. So today's topic actually goes well with the theme of this year, enabling breastfeeding for working parents. So we are going to talk about expression and storage of breast milk. So first of all, I want to ask you about when is the right time and when should we start expressing, once to start expressing the breast milk?
Yeah. So the right time is actually in the first day itself. We have to prepare the mother. Soon after delivery, we have to prepare the mother, and within 6 hours of delivery, we have to show her how to express the milk. Because if we will wait till second or third day, then the breast may become engorged or there may be tenderness on the breast. So we have to prepare the mother how to express the breast milk, and during tenderness it is very painful. So after delivery itself we have to encourage the mother and we have to show the process how to express the breast milk. And here are especially some of the conditions
Okay.
when we can express milk. So if there is engorgement of breast, when the breast will be full or tender and the milk will not come out, the breast will get engorged. So that is one of a condition when we have to express the breast milk. Second thing is if the baby is preterm and low birth weight and the babies cannot coordinate with the sucking process, at that time the mother can express the milk. And if the mother is a working mother, if she has to go for work, that time she can express the milk so that the baby can have the feeding later on. Another condition is there if any if there is any breast condition like with protectile nipple or inverted nipple and the baby is trying to suck from the nipple, at that time for the first few days the mother can express the milk so that she can feed the baby. And some more conditions are there like mastitis or fissure formation in the breast where breastfeeding is not at all possible. At that time the mother can express the milk. So these are some of the conditions.
Okay. So as of common mother, we know the external part only, the breast getting hardened, and we know all that. But what's happening internally? Can you explain on that? The hormones and what are the hormones involved? So
Yeah.
why it is happening?
So what happens during to maintain maintain the lactation, especially two hormones are responsible to maintain the lactation throughout. First one is prolactin and the second one is oxytocin. So the prolactin hormone is responsible for the production of milk. And this oxytocin hormone is responsible for ejection of milk. Ejection means the milk flow from the breast. So how we can stimulate, because this prolactin hormone and oxytocin hormone, it is stimulated in the posterior and anterior pituitary of our brain. So the thing is that when we are stimulating our the breast, then this prolactin hormone and the oxytocin hormone will get stimulated, and the mother can feed. So how we have to stimulate the prolactin hormone? Just thing is that suppose this is a breast model, so we have to ask the mother to just gently stroke the breast, and she can stimulate the nipple so that there will be like stimulation will be there, and the prolactin hormone will be released, and there will be formation of milk. And while releasing the oxytocin hormone, we have to advise the mother to be very comfortable, because here psychology, it plays a very vital role. So when the baby will be with her, we have to ask the mother to be with the baby, to hold the baby in her lap, to see the baby, and then she have to think good about all the, like she don't have to be very anxious or panic. She have to be like, the thoughts should be very good, that she is able to breastfeed the baby. So all those thoughts will create a very good impact, and oxytocin can be released. And other than that, if we talk about support from the family, we can ask the husband or the mother-in-law to give a back massage to the mother. Okay, so like what happened while massaging, also the oxytocin reflex, it gets stimulated. She can have a warm shower, she can have a warm compress in the breast, or she can have some warm drink like warm milk or warm water, and those things can stimulate the oxytocin reflex, and the milk flow will be very good.
Okay. So we are talking about expression of milk. So what is the right thing to do while expressing? How to express? Can you demonstrate using the model?
Yeah.
Yes.
So how we have to, the first thing, like as a counselor, what we used to advise, that we should not touch the mother's breast. Thing is that we have to demonstrate on the model, or we can show in our own body. So like the first thing is, we have to hold, or we can just hold the model, and we have to advise her that before expressing the milk, we should not we should not wash the breast or the nipple. Okay, so we have to hold the areola. Areola, this is the black part of the nipple. So the thumb should be in the areola. We have to put our thumb here. The index finger should be just below the nipple, and these three fingers, with the rest of the three fingers, we have to support the breast. Okay, and the thing is that we have to just press and release, press and release, and we have to, it should be inward towards the chest. Thing is that if the mother is getting hurt, that means the technique is not good. She should not be hurt. And some of the mothers, what they used to do while pressing, they are doing like this. They are squeezing. They're squeezing the and the areola, but it should not be done. We should always press the areola just like the baby suckles. So we have to be, like we say, no, breast full of mouth. So just like that, we have to press with the thumb and the index finger inward towards the chest wall. So this is the exact technique, and we have to press for the whole breast. Okay, because we have to be very careful so that the duct will get, if there is any blocked duct, it will get released. So when we will press, the milk will come out. And the first thing is that if a new postnatal mother in the first day or second day she is expressing, then it may take time, like 10 to 20 minutes it may take. After that, if she is expressing, when the flow will be there, then she can move to the other breast.
Yeah. Okay. So we shouldn't expect like a large quantity of milk in the first few days of birth, right? Yeah, we are expecting in 30 to 50 ml maximum. That too after 3 days.
Yeah, actually, in the first 2 days only colostrum will be released, and colostrum is very thick quantity. So while releasing, the mother should not be very anxious that milk is not coming out, because colostrum is very thick in quantity. So while releasing, she have to think that is thick. So it may not be flow of stream, but that is sufficient for whatever it is coming. It is sufficient, and she should be prepared from the first day itself to express. Later on, there won't be any issues.
Yeah. Okay. So where do we express the milk, and how do we store it? I think it's a network issue.
Yeah, can you hear me?
Yeah. Am I stuck? Can you hear me?
Yes. You are audible.
Okay.
So the container should be it should be a steel container or a glass container preferably, and we can keep in a mug also, mug or a cup. So before expressing the milk, we have to clean the container with soapy solution, soapy water, soap and water. We have to air dry it, and after that we have to put some, before expressing, we have to put some boiled water in the container, so that if any other disease causing germs or organisms will be there, it will get killed. So before expression, we will express the breast milk, we have to throw that water. After that, we can keep the breast milk. And if we talk about the storage, so in a normal room temperature, we can keep the breast milk in an airtight steel container for 6 to 8 hours. But if we are talking normally in households, if the mother is going for work, we can keep in room temperature for 6 to 8 hours, and in the freezer compartment we can keep for around 72 hours.
Okay.
So that yeah, in deep freezer also we can keep.
Okay.
But
So what is the time interval? How frequently can a mother express the milk?
okay, so during the first few days, the interval should not be more than 3 hours. At night time, in an interval of 3 hours, she can express. During the daytime also, like the interval should not be very long, because we say no, the more the baby will suckle, the more milk production will be there. So the same principle will be applicable here, because the more the mother will express the breast milk, the more milk supply will be there, and that prolactin reflex will get stimulated the time when she will be expressing the milk. So when the prolactin reflex will be stimulated, more milk production will be there, and throughout the day she can express. But the duration should be more than 3 hours.
Okay, talking about expression, it is really required to express the breast milk often, or it is up to the mother? On what condition should
Uh,
we express it?
See, if the mother is working, if she have to go for a work for and office is far away from the home, there can be a chance of milk leakage. So at that time she can express. In some of the mothers, there can be tenderness of the breast, and like it's very uncomfortable. At that time she can express. And if she thinks that she have to feed the baby with her own breast milk, so before going to work she have to feed, then till 30 minutes she have to express the breast milk, and the milk can be stored in a room temperature for 6 to 8 hours until she came back from the work. So these are some conditions for the working mothers where she can express the breast milk.
Okay.
And hand expression, we have already told how to express.
So talking about manual expressions, there are any other way that we can express milk, like we can use an hand pump or an electrical machine to take on
Yes,
that?
hand pump can be used, or this electric pump which is available in the market we can use, but usually mostly we are focusing on the hand expression. The hand pump we are using only because just to relieve the congestion or the engorgement, but hand expression is the most preferable method, I feel.
Okay. So is there any difference between manual and the artificial pump expressing? Is there any differences?
See, actually, this hand, it is very feasible. If we are expressing through the hands, it is very feasible. But for this electrical pump or the syringe pump, there are some techniques. So if it is available in the market, all the procedure guidelines or user guidelines will be there how to use it. So they can go through the manual and they can follow it.
Okay. Okay, then now, as we are talking about expression, so if a mother is not ready to breastfeed and she can opt for donor milk, no? So can you give some clarity on the donor's milk, how to use the donor's milk, and is it really safe? There are many confusions nowadays to use the donor milk or not. What if the donor has any health issues? So can you please elaborate on that?
Okay. Actually, nowadays in most of the hospitals, breastfeeding friendly hospitals, they are having a milk bank. So it is quite completely safe, because while going through the process, they are looking at the status of the mother, whether the mother is HIV positive or she is having any infectious diseases like hepatitis C or hepatitis B. So there is no need to worry, because it goes through a complete screening process. So if a mother feels that she have to breastfeed her baby, rather than switching to the formula feeds, because formula is totally, if the mother, she should totally avoid it. If she is not feeling that her milk is not enough, that is also another topic actually. He can, or if the breast condition doesn't permit her to feed her own milk, she can always go for the donor milk, which can be collected from the milk bank, human milk bank. Nowadays, like every maternity hospitals, they are having the human milk bank, so the mother can opt from that.
Yeah. So human breast milk bank is same as the blood bank. So they test the milk, they go through all the process of testing and they sterilize the milk and then only they give it to
Yes,
the other babies. Yeah.
yeah.
Okay. So as we are also talking about storage of the breast milk, we can store the breast milk other than any steel containers like a package, readily available utensil packets and etc.
Actually, we can always store the breast milk in. As I have already told you, if the mother is working in the household, she can store it in a steel container, which
Hmm.
should be airtight in a room
Hmm.
temperature or in the refrigerator. But in the hospitals, if the mother wants to take the donor milk, then it can be stored in a freezer compartment.
Hmm.
So in a freezer compartment, temperature will be less than minus 20 degrees centigrade. For 6 to 12 months, it can be stored. And if we are talking about the container, there are some freezer milk bags
Hmm.
available.
Hmm.
Milk bags will be
Yeah,
available.
milk bags.
So it can be
Yeah.
stored
Hmm.
in milk bags.
Yeah.
Yeah.
So I want to make clear on that too. So what else you have for the, shall we talk about this milk is not enough, that problem. So that is the common problem every mother faces and it is not enough. We are talking on that topic. So can we talk on that topic?
Yeah, so that is really psychologically it is very difficult for the mother because when she will feel that the baby is not getting enough milk, so that is a psychological barrier which will inhibit the breastfeeding reflexes, as I have already told, the prolactin reflex and the oxytocin reflex. So
Mm.
thing is that we have to build the confidence of the mother actually. So building
Mm.
confidence comes like we have to educate her properly regarding the stimulation of the hormones, how it will get stimulated. The more the baby will suckle, the more milk production will be there. And to see the adequacy, like if the baby is getting enough milk or not, she should always check for the urine output of
Mm.
the baby. How many diapers are there in a day? Mainly,
Mm.
like primarily we are telling that 6 to 8 wet nappies in a day, and also a most primary indicator is the weight gain of the baby. If the baby is gaining weight properly, she should not worry
Mm.
that the baby is not getting. So we have to train or we have to educate the mother and the family members that the more the baby will suckle, the more milk production will be there. And one thing is that if we talk about the fore milk and hind milk, because some of the mothers, what they used to do, after 5 minutes when they're feeding, they're switching on to the
Mm.
other breast. So at that time, on fore milk, which satisfies only the thirst of the baby, only that part only the baby will get.
Mm.
The main the hind milk, which is responsible for weight gain, which is very much rich in fats and glucose, that part the baby will not get. So that's why we have to encourage the mother to feed the baby in one breast for 15 to 20 minutes at least.
Mm.
After
Mm.
that, she can feed the other breast. So these are some of the advices which we can give to the new mothers.
Yes, it is important to drain the breast completely in order to make the secretion and the flow going on, right? Okay.
Yeah.
Okay. So any other information that you'd like to give apart from this topic based on the breastfeeding thing we are doing? Is there
Yeah,
anything
actually
in general?
this year the World Breastfeeding Week theme is about let's make breastfeeding work.
What?
So
Yeah.
it's based on this. So
Mm. Mm.
thing is that I will because I am also a mother. The difficulties
Mm.
which I face that should I mean I want that the other mothers, the upcoming mothers should not face those difficulties. So nowadays in the hospital breastfeeding rooms are there. There should be availability of breastfeeding rooms even in the offices.
Mm.
So the office colleagues of the mother, working mothers, the
Mm.
higher authority administrative people, they should always look onto this matter
Mm.
because the mother will need breastfeeding breaks
Mm.
because it is really little bit psychologically disturbing for the mother when she will
Mm.
leave her baby in the home and then
Mm.
she will have some comfort. So there should be some breastfeeding gaps and breastfeeding room should be available so that she can go and breastfeed the baby and she can enjoy.
Mm.
So it's a very nice journey. So exclusive breastfeeding till 6 months and extended breastfeeding till 2 years or beyond. So journey should be comfortable for the mother. So both of them, they will enjoy. Both the baby and the mother will enjoy. The mother also, she will enjoy her motherhood journey. So that is the thing. The corporate sectors or even the government people, they can look onto that, building breastfeeding rooms and support from all the colleagues, work colleagues, mother.
Yeah. Okay. Then, as we talked about this, can you elaborate on the positioning of the baby and the mother? Like, can you demonstrate or give us some clues about what could be the ideal position for an proper latch and weight?
Okay. Ideally, if we are talking about a position, we have to, there are many positions. Cradle hold position is there, cross cradle position is there, football positioning for the twin babies. So especially the mother should be very much comfortable. It's not that she will just sit in a somewhere and she will feed the baby. The mother should be very relaxed and comfortable. Some support will be there in the back, in her lap and in the side, so that like some pillows should be there. It's not that like she will just sit somewhere and she will feed the baby. It should be there while she is breastfeeding the baby. And latching and attachment is a completely different topic. So that I think we have discussed in our sessions. So latching means cross. This is a cradle hold position. If I have got my baby, I could have shown. So
Yeah, I can use the model and
yeah. So in the cradle hold position, we have to we have to hold the baby should be in a very straight position. Okay, it should be in a straight position, and the whole of the areola should be inside the baby's mouth. See, the baby should not suckle on the nipple. If the baby will suckle only the nipple, there will be no milk, no release of milk. So the areola should be inside the baby's mouth, and the mother will know that the lower lip, it should be everted. The lower lip should be everted, and the baby will take a little of pause. He will suck and pause. There should be a little bit of pause, and we will take it for swallowing the milk. So these are some signs where the mother can know that the baby is getting proper milk. And if the positioning is not correct, that means the baby will not get milk. So we have to focus on the positioning specially, and that is a completely different topic with the positioning and all, how to give a good position.
Just a basic explanation I would need. So I think we covered most of the things in this topic. Actually, we covered everything that we could. So anything else that you want to talk or elaborate on this?
Okay, so like the mainly I want to focus that if the mother is expressing the breast milk, so if she can just consult. Can you hear me?
Yes, yeah, I can hear you.
Thing is that the healthcare personals, they should be well educated regarding breastfeeding, because directly I've seen in our place also out here in Assam, directly they are switching to the formulas. They are not even trying. So we have to let them know the importance of breastfeeding. Why is it is important? Breastfeeding is not only important for the baby, it is important for the mother and the community at large. So to teach them the importance and what are the composition, why the colostrum. See, colostrum, only little bit colostrum will be there secreted for the first, and that is enough for the baby. So the mother should not think that I am not having enough milk, the baby is not getting. So all those meat we have to tell them. So we have to discuss this bottle feeding or formula feeding practices, and we have to encourage breastfeeding even at work or even though the mother is in work. So we have to put it with home and work.
Yeah. So prior education on this topic is very, very important for pregnant mothers. Like they should at least attend a class or have something read on this topic. That is very, very important to have that confidence going on. So that is what I would.
Yeah, actually build the confidence from the antenatal period itself.
Yes.
We have to from the antenatal period itself. Then only she will have the confidence to feed the baby after the baby gets born. Because I have already told you, if she will be psychologically disturbed, all this hormonal will be there. So there will be problem in the journey. So is that we have to prepare the mothers from the antenatal period itself.
Yeah, the mother psychologically is affected, so it affects the whole cycle of the breastfeeding again.
Yes, yes.
Yeah.
That's why we are telling that while the mother is feeding the baby, she have to look at the baby, she have to feel the baby. And one concept is there, bedding in or rooming in, we can say. The baby should be always with skin to skin contact is very much important. Yeah, that there will be like psychologically the mother will be ready. She will be prepared that she have to feed the baby. So skin to skin contact concept is very much important, and all these things we have to educate the mother beforehand.
Yeah.
Because yeah, after the baby gets birth, they will be separated. Mother will be in the post-operative room, or post after labor she will be there, and the baby will be somewhere in the baby room. So these things we have to build the bridge between all these things, all the gaps.
So even I was separated from my baby. She was kept in the cradle, and she was asked not to touch by the mother. They were like, "You keep her in the cradle. You should not hold her." So if I would have had the proper knowledge or any classes going on, I would have had a better experience with baby. So we are here to do that.
We are here to educate the new
mothers. Yeah. So that was very informative sessions from you, and we are looking forward for more sessions like that. So anything from your side or any questions from the audience side to us, we'll be happy to answer any questions. So wait for 2 minutes and then we'll answer. Do you want to add anything else to this?
No. Thing is that while I delivered my baby, the same thing happened. He was kept in the baby room. He was a formula fed baby for the first day actually, and I was I have undergone cesarean section, so I was not in a condition. So it was the responsibility of the health staff out there. But thing is that they were not aware. So I would always suggest that the hospital should be always breastfeeding friendly.
Yeah.
If the will be breastfeeding friendly, if they will follow all the 10 steps of breastfeeding friendly hospital, I think all the mothers will be comfortable, and they have to discourage all these formulas in the hospital. When the formulas will not be discouraged, they will always switch to the formulas, because one alternative. So that's why
that's an easy way out. Yeah.
This is the need of the hour. We have to educate the care personnel first, then only we can go to the mothers. If the healthcare personnel will be like they are neglecting the benefits of breastfeeding and they are just switching as an alternative to the formulas, that is a very big discredit. So we have to discourage this.
So breastfeeding is one of the natural phenomena that has to happen, but we are intervening so much that we are now campaigning about breastfeeding, and we are talking on this now. So it was very easy earlier, and now it is very tough, and people are opting for that. Like you said, if there is a way, then people obviously will choose formula over breast milk. You were right.
And mostly breastfeeding is very much economical. So I don't know why people are switching over this formula products. It's very costly.
Like we did the experiment on making the formula in induction, and we had so many experiments in the class. No, it was very tough actually to make breast milk for a very newborn, because they don't know, they cry, they become restless after some time. It is very tough to make formula at that time.
That is true. It takes time for preparation also.
Yeah,
time for
it takes around 15 minutes. Yeah, 15 to 20 minutes. By the time the formula is ready, yeah.
I think there are no questions.
Okay, so we'll wind this session up. Okay, I'll save the live, and thank you. It was a very lovely session with you, and I'm looking
so much
forward for more sessions. Bye.
Thanks. Bye-bye.
Thank you.